All right, guys, welcome back for another question and answer session. As you guys know, we love doing these because we learn sometimes just as much as you do. So let's get started.
Yeah. So I have eBeth XO. She would like to know, how is a breast lift done?
Well, so a breast lift is a breast shaping procedure. And exactly what that entails depends on what the patient needs. And then, of course, the breast lift procedure can be chosen by the plastic surgeon. There are many. And of course, it can also be customized, and it should. Simply, there's really kind of three main breast lift procedures with regards to kind of incisions that you can get. So there's an incision around the areola. There's another one that's an incision around the areola, then down the breast. And there's another incision around the areola, down the breast. And then I prefer to go out to the side. Of course, some people like that kind of smiley face, anchor type incision. So a breast lift is usually making those incisions, shaping the gland that's there, and then removing some skin and closing everything. That's kind of what a breast lift traditionally is.
Okay, and then I have Alma85255. She would like to know, do you take lymphedema patients?
So there's lymphedema and there's lipedema. So lymphedema means that your lymphatics are somehow impacted negatively. So usually that is something that is managed with compression, and or a vascular surgeon can go in there and address some of the venous lymphatic kind of problems. Lipedema is when you have kind of lipedema tissue, which is not a completely understood phenomenon, but it's basically this kind of fat and lymphatics, primarily down in the lower legs, and usually that's treated well with certain types of liposuction. So lymphedema, you probably want to evaluate why you got lymphedema. Usually you work with compression clinic and or with a vascular surgeon. Lipedema, plastic surgeons can take care of, and I do take care of those patients. There is some patients who have lymphedema, and they can still benefit a little bit from the liposuction process, as long as there is no correctable lymphedema causes that can be addressed.
Right. And then I have Short Wizard. She would like to know, what happens if you get pregnant after a plus-size tummy tuck?
Yeah, so we've had a handful of patients that have successful pregnancies and deliveries after tummy tucks. And, obviously, as the babies grow, the skin gets stretched, so the tummy tuck result gets maybe modified some. But in general, I'm surprised how well the abdominal area and the waist area really remains after getting pregnant and delivering. And I think obviously the skin is now in good shape and the muscles are in good shape. So I'm actually surprised. The most common thing that I see is that the belly button gets a little big after getting pregnant again after a tummy tuck, but all those things can be revised.
And then I have Chantel E. She would like to know, is it best to get a septoplasty and rhinoplasty together? If
you need a septoplasty, then doing it at the same time as your rhinoplasty is a perfect time to do it. Oftentimes, depending on what your nose needs, the septum needs to be addressed anyways, either reduced because you have a bump in the bridge of your nose, or sometimes you need to borrow cartilage from the septum in order to build some of the structure of the nose. And so that's a great time to do both at the same time.
And then I have Melinda Forrest. She'd like to know, is there an age restriction for a plus-size tummy tuck?
There isn't. Our oldest patient, I can't remember 100%, it's either 76 or 78 years old, and they did great. Actually, just a couple of minutes ago, we had one of our patients, I think she was in her 70s. She came back for a follow-up. I think she's maybe 5 or 6 weeks out, looking great. So age is just a number, just like BMI is just a number. It doesn't really tell us much. We have to dive in to see how the heart's doing, lungs are doing, just overall how the person's doing physiologically.
And then have Shannon M. Bravo. She'd like to know, where do you do thigh lifts and where do you put the incision for thigh lifts?
I do perform thigh lifts. Just like the breast lift question earlier on, there's lots of different types of thigh lifts that can be done. It all depends on what the thigh needs and what the patient wants. The classic incisions are either a horizontal or kind of a bikini incision, right, where your leg meets your pelvis, right, so kind of in that growing area there, or vertically on the inside of the thigh, so basically from your groin down to your knees like that. It all depends on what's needed and what the patient desires. Obviously, the first one has less of a skin pull, the second one more contouring but longer incision.
And then kind of going back to that breast lift question, I have Mallory McCard. She'd like to know when you do the anchor lift or the breast lift, does it help with side boob?
Well, I don't, so the anchor lift is when you have that incision at the bottom, and I actually don't use that. I don't feel like I need it. So I'll do the circular incision down the breast, and then it curves out to the side like towards your bra is. That curvature of incision can continue and get that side breast area. If the side breast is just full, you can liposuction, and you should. If the side breast area is loose skin, then you can continue that incision towards the side of the chest there and then excise more skin. If you have quite a bit of loose skin, then you should consider coupling the breast lift with a bra line back lift, because the bra line back lift then comes from the other side. So the side of the chest gets met with two procedures and all that skin gets removed.
Thank you. And then I have Olivia 77. She'd like to know, what does a typical recovery for a mommy makeover look like?
So a mommy makeover can be a lot of different things, right? So it can be just a tummy tuck by itself. It can be tummy tuck and breast, but honestly, it can be anything you'd like to put in there. It basically implies, hey, we're doing surgery to improve the body after changes have occurred following pregnancy. So technically, if you want to get, let's say, a buttock fat transfer after you've had a pregnancy and delivered kids, then technically that could be your mommy makeover. So a mommy makeover could be a lot of different things. It's usually something with the tummy and something with the breast. The recovery depends on what those procedures are. So if you're getting a tummy tuck, we usually say the first 2 weeks, focus 100% on your recovery. Second 2 weeks, more of the same unless you absolutely have to do something. And then no working out for 6 to 8 weeks.
All right, and then I have Shantae, Wisconsin. She'd like to know, how many pounds on average come off with a plus size tummy tuck? For reference, she's 300 pounds.
Well, it varies from individual to individual. I don't look for a weight to remove or a liposuction volume to extract. I just look for contour. And so it depends on where that volume is and how much it is and how thick the tissue is as well. I mean, we've taken out 30, 40 pounds worth of tissue on some patients. But the goal is to, at the end of the day, is you're really listening to the body. The body will tell you where to remove the fat, where to remove the skin. So the body is guiding us how much tissue removal is to be done and where that should be done. So putting the amount of tissue to be removed ahead of that is like putting the proverbial cart before the horse. So at the end of the day, you just want the best contour possible safely.
Then I have Julieta Rico. She'd like to know, how are you able to operate for 10 to 12 hours?
Well, it's getting harder and harder, that, as you can imagine. So I'm 47 right now, and I've been at it for about 16 years. In the beginning, it would just, you would do a big surgery and you'd go home and you wouldn't really feel much. And then now you do a big surgery and then you go home and you feel that surgery. So your forearms are sore and your back's sore and your hands are sore. But we did a podcast with one of our patients recently, and that was one of the questions that they asked us, and I just have to be better about investing in my health. So I try to eat pretty good, and I try to stretch and do things that I can help my body out so that I'm not sustaining too many injuries, and then also I can recuperate the fastest. I think the hardest thing right now is, you get these little pains in your hands and in your wrist because they're basically repetitive use. So they're like basically tendonitis. And if you are doing a good job of all the things that you need to do, then you can recuperate. The next day, you're pretty much back to where you were and you can start over again. And if you don't, then the next day is just going to add more pain on top of that one. So thank you for that question. It's, it's just a work in progress. You just have to kind of go through the pain.
Oh. Then I have row_lane13. They would like to know, how would you approach a patient with very saggy skin from excess weight loss?
Well, it all depends on where that loose skin is, right? So that skin has lost its elasticity, meaning it cannot be stretched and then let go, then bounce back. And so the only way to really fix that is to remove the loose skin surgically. That's where I come in. And so if you have that loose skin on your tummy, we have to do a tummy tuck. If you have that loose skin on your arms, you have to do an arm lift. And you can kind of see where we're going with that. Again, just like the prior question, we can do surgeries up to 9, 10, 11, 12 hours. So you'll have to take a look and see which ones are your priority. You can oftentimes do tummy, back, breast, or tummy, back, breast, arms potentially. And of course, if you still need to do buttock and thigh and something else, then we might want to do a two-stager.
And then have Garden of Vanity. She'd like to know, can you do a bra and back lift and then a tummy tuck later, or vice versa? And which would you recommend doing first?
Yep, you can certainly do them together or separate. Like, so today we did a tummy tuck on a patient, and they were considering also doing a bra and back lift, but she ended up deciding just on a tummy tuck. And then so she'll most likely come back in the future and get a bra and back lift. There's no wrong or right answer. You can do it either way. It all depends on where that loose skin is, because if you have quite a bit of loose skin on the side of your chest, and then maybe your breasts also need to be lifted, you should consider doing a breast lift, bra line, back lift combination, because that allows me to remove as much of that loose skin on the side of the chest. There's no wrong or right answer. You just choose whatever is most important to you.
Right, and then I have Lauren_Skur. She would like to know what can be done to avoid keloid scarring if you're a known keloid scarrer.
Keloid, I think. So keloid is excessive scarring beyond the boundaries of where the tissue injury occurred. So it's very rare for people to actually have keloid scars. It's usually a combination of things, but a big genetic component. Most of the times when you see people with wide scars, they're just wide scars, just because there's maybe too much tension or not enough sutures. And then some people, you see people with thick scars, well, those are hypertrophic scars. That just means that maybe there was a little excess inflammation in there. And that's usually also the surgical process. Very, very few people actually have keloid scars. So I think you're primarily interested in how can I avoid hypertrophic scars. Your surgeon should be able to manage that for the most part, although you can do a couple of different things on your own and prevent excess tension on the incision. So afterwards, let's say you get a tummy tuck, don't do like back bends for the first 2-3 months, because obviously that's putting tension on the incision.
And then I have Butterfly Kisses 700. She'd like to know, I have an umbilical hernia and I had 2 C-sections in the past. When I get the plus size tummy tuck, how will you take care of the muscles and what type of outcome can I expect?
Well, I always remove the C-section scar, so that goes away with the tummy tuck, because my incision goes below that, so that removes the C-section scar. And then whatever hernias that we run into in the abdominal wall, umbilical hernia, ventral hernia, things of that nature, I repair. And that's included in my tummy tucks. I don't charge actually for that. There's no mesh involved. There are certain hernias that I won't be able to see with a tummy tuck. So like hiatal hernia, it's a hernia in your diaphragm that's deep inside. I guess you can have like a inguinal hernia, and then if that doesn't bother you, I might not see it. And of course I won't notice it in the operating room. So that's an irrelevant kind of situation. So long story short, I will do whatever your body needs me to do to get the best result possible during that surgery. You don't have to worry that somehow I won't look for it or I'll miss it or something like that.
Right, and then I have Rachel_Ruth Maslove 77. She'd like to know, does a fleur-de-lis tummy tuck include rectus muscle repair?
All my tummy tucks include muscle repair if needed.
And then I have Brittany Batowski. She would like to know, does pricing depend on the person you work with, or do you have a flat rate?
No, it totally depends on the person that you work with. So, for example, last week we did one patient that was 5 foot tall, 100 pounds. And then we did another patient that was maybe like 5.5 foot tall, 300 pounds. Those two people are fundamentally different procedures, even though they're both quote unquote tummy tucks. The amount of work that's required for one is different. The type, the amount of liposuction, the amount of excision, the amount of sutures, all that stuff. The amount of time in the operating room is different for those two people, and therefore their prices will vary. Our prices are dependent 100% on the time that we need to spend in the operating room to accomplish our goal.
And then I have Ray_Alexa. She would like to know what BMI is considered a plus size tummy tuck.
Well, traditionally it's 30 BMI. Sometimes you can also discuss 35. So it's between 30 and 35 depending on the source of the information. But basically, if you think about it, anything above 30 is basically obese, right? Above 35 becomes morbidly obese. So technically, as soon as you get into like the 35 range, at least for me personally, 35 and above is plus size tummy tuck.
And then I have Jess F. Des 86. She would like to know, does a tummy tuck cover me for disability time off of work?
I don't know. I mean, I guess it all depends on the state that you're in, your employment characteristics, any kind of paperwork that you need us to fill out for your employer, disability, that kind of stuff. We're happy to help out with.
Perfect. And then Steph_Seattle. She would like to know what determines the final result of a tummy tuck procedure. Why are some people more curved and others more flat?
Well, so I do everything that can be done and should be done in the operating room to get the best result possible. However, there are a couple of things that I can't do anything about, right? So number one is intra-abdominal fat, fat on your organs underneath the muscle. I won't be able to liposuction those, that fat's on your organ. I can't do anything about fat that's on top of your liver, on your small bowel, pancreas, that kind of stuff. That's intra-abdominal fat. So that will potentially limit how flat I can make someone. That can also potentially limit how curved I can make someone as well. The other component is the ratio of rib width, pelvic width, and then how long their waist is. We all know people whose ribs are fairly flared and whose waist is fairly short, and it's really hard to get a super narrow shape for those patients. There are other people who have narrow ribs and very long waist, and you can really contour them a lot. So long story short, I do everything that I can in the operating room to get the best result. There are some things that I can't control.
And then I have Boof Bam 123. They would like to know, if I'm getting a BBL, can you take fat from any areas of the body, including the neck or arms?
You can. I mean, there's not a ton of fat in the neck or a ton of fat in the arms to get us what you most likely want with a buttock fat transfer. Buttock fat transfer usually requires at least 500, 750, or a liter of fat per buttock cheek, ballpark, for most people. I rarely see anyone needing less than 500. It's usually 6, 7, 8, a liter. And so as you can imagine, I just can't envision you having a liter of fat in your neck or your arms, sometimes arms. But yeah, long story short, you can take fat from anywhere, but everything is based on time in the operating room. So if you're liposuctioning the neck and the arms, but then we also have to liposuction something else in order to get the adequate volume for the buttock area, we're spending more time in the operating room. So your quote's going to reflect that.
Thank you. And then I have row_lane 13. They would like to know, can you explain the healing time for a tummy tuck?
Well, healing progresses consistently as long as you don't do something to your body to reduce that healing phase. And so the first 2 weeks, we just tell people, focus 100% of your time on your recovery. Don't do anything. Second 2 weeks, more of the same unless you have to go back to work or there's just some things you can't avoid. 6 to 8 weeks for working out, but honestly, you'll probably still be swollen for 3 or 4 months or longer after surgery. You might be tender for about 3, 4, 5 months after surgery in terms of certain activities. You may want to wear compression for even longer than 8 weeks. Sometimes I think patients should probably wear compression even for about 12 weeks after surgery. So it varies from individual to individual because no tummy tuck is the same. But also, it takes a while for your body to really do all the things that it needs to do to fully heal.
And then I have Tanya C. She would like to know, is fat transfer to the breast a common option, and do you perform that?
I do perform it. It works great, totally safe. It all depends on what you're trying to accomplish. Because let's say you have an A cup and you want to go to a C cup. Most people can't make that jump with just fat transfer by themselves. You might have to do it in 2 sessions. If you're a B cup and you want to be a small C cup, fat transfer will most likely be able to do that. The other component is some people want that kind of fake look. Well, fat's natural. It's not going to give you that fake look. So give that some consideration.
And then I have @Cindy_. She'd like to know, can I have a fat transfer to my buttock and also have a tummy tuck done in the same procedure?
Yes, you can. We do that all the time.
And then I have Boof Bam 123. They would like to know, how can you tell the difference between intra-abdominal fat prior to surgery? Does it feel or look different?
Well, so let me step back. The reality is that I'll do everything that I can do with your extra abdominal fat, liposuction, muscle repair, skin removal to make you look as good as you can. And then so whatever's left behind, it's rib size, waist height, intra-abdominal fat. And you can decrease your intra-abdominal fat on your own before or after surgery, and it won't negatively impact the tummy tuck result. To decrease intra-abdominal fat, it has almost nothing to do with the gym or working out. It's primarily food intake, basically anything that's absorbed quickly through your GI tract, processed foods of any kind, will primarily be stored intra-abdominally. And so if you lay down flat on your back, for example, and your waist becomes concave, that's probably a good sign that you don't have a lot of intra-abdominal fat. If you lay on your back and your tummy is still rounded out, there's probably a pretty good chance that you have at least some amount of intra-abdominal fat.
Thank you. And then I have Keisha_P1989. They would like to know, can you get rid of vaginal fat like under the top of the stomach?
Yeah, so I include a pubic lift with my tummy tucks. I also include a pubic liposuction with my tummy tucks.
And then I have Vanessa. She would like to know, have you ever worked on patients with hidradenitis suppurativa?
HS, hidradenitis suppurativa, yes.
And then she said, if so, what is the process like and how is it different from a normal person?
Not really any different from obviously the goal is for me to excise all that skin that tends to be HS for you if I can, right? So I'm not going to change my incision to make sure I take it all in, because then you'll have a weird looking incision. So, but the goal is if I can adjust the incision a little bit here and there to include all that HS, then I'll do so. The only caveat is if that HS is near our surgical site, we don't want to be active HS. So obviously if you have an active infection, we want to wait until that's dormant. So otherwise it doesn't really impact what we do.
Okay. And then I have MGY_Y. They would like to know, I want to fly over from the UK for surgery. What should I expect in regards to traveling?
Well, so we have a lot of patients out of state and out of the country. We've had maybe half a dozen to a dozen from the UK prior. The longer you stay here, the better. You get peace of mind, some of your energy back, or you get a chance to see me more often. So obviously you'll want to be here maybe 2 days or so before your surgery at least, just so you can acclimate and get things situated. Then you want to be here after surgery for probably at least 2 weeks, longer if you can, especially with a long flight back.
Right, and then I have Short Wizard. They would like to know, is there any instance when a plus-size tummy tuck is covered by insurance?
I don't think any tummy tuck of any kind, plus size or regular size, will be covered by insurance, because by definition that is a cosmetic procedure. Insurance may cover something called the panniculectomy, but that just is removal of the tissue that overhangs your pubic area. That's not liposuction, that's not skin removal above that area, that's not contouring in general. That's just direct excision of the area that overhangs your pubic area. We stopped taking insurance, I think maybe about 4 years ago. So unfortunately, we do not accept insurance.
And then I have Form Love of Hair. She'd like to know, what is a brachioplasty recovery like? How long should someone plan to take off of work?
So brachioplasty is an arm lift. There's different kinds of arm lifts, but most people have an incision from your armpit to your elbow. I also do some liposuction there. I think that makes it look better. Probably similar to a tummy tuck in terms of guidelines. I'd probably hang out here in Scottsdale for at least a week, if not 2 weeks. You have to wear a compression garment for at least 6 to 8 weeks. Probably don't work out for 6 to 8 weeks. The more you keep your arms elevated, the more you take it easy, the faster your recovery will be.
Thank you. And then I have Brina PSJ. She'd like to know, is your BMI vital in a breast reduction? In the UK, your BMI has to be 30 before getting a reduction.
Yeah, I don't have any BMI or weight parameter restrictions for any of my procedures, because you can have a BMI of 35, 40, 45, 50 higher, and your heart, lungs could be good, your metabolic situation can be good, and so you can otherwise be a great candidate for surgery. Conversely, you can get someone with a BMI of 25 and they can have the equivalent of like metabolic syndrome, right? And so they can have uncontrolled sugars, who knows, maybe they might have, some uncontrolled hypertension, heart, lung issues, that kind of stuff. So just going by the BMI does disservice to the people who have potentially a higher BMI, and also still exposes you for risk if that's all you look at for people that have a low BMI.
And then I have iBonanza. They would like to know, what type of suture procedure do you use or prefer? What is the least visible type?
Well, all my sutures are dissolvable for tummy tucks, same for breast, basically same for all my procedures, with the exception of facial procedures. Once I go into facial procedures, I usually put non-dissolvable sutures, very small, and I usually take them out 3-4 days out. But for tummy, breast, arms, thigh, skin removal, body contouring, any kind of sort, I usually put dissolvable sutures, and you don't have to really worry about it. They're all internal and they all dissolve.
Thank you. And then I have Sleep with Sarah. She would like to know, how do you decide between a tummy tuck and a fleur-de-lis?
Yeah, so a fleur-de-lis is a type of tummy tuck. It just means that there's also a vertical incision above and below your belly button. And so I always start off with the horizontal incision, and I determine whether the vertical one is beneficial at the end if the patient wants me to do that. So obviously, if we can get the best contour possible without doing the vertical incision, we will. If we're getting a very narrow waist, but then there's a bunch of loose skin in the center, and then we need to do a vertical incision to remove that skin. So that's where the fleur-de-lis comes in.
And then I have Miss Iris 477. She would like to know, I am a diabetic. What is the number my A1C needs to be prior to surgery?
Yeah, so that means your hemoglobin A1C is probably at least 6.5 or higher. That's kind of traditionally what diabetes defined at. So first, when you have surgery, your glucose increases because your body senses the stress increases glucose. So what we really don't want is we don't want your fasting glucose in the morning to be high, because that would then result in your sugars being even higher during surgery, maybe even higher in the recovery. So the hemoglobin A1C is not necessarily like a straightforward way to decide how high or how low it should be. If you don't have a constant glucose meter, I'd probably get one either through your doctor, or you can get one on your own through a couple of the websites online. And that will allow you to give you glucose monitoring throughout the day on your phone. Now, you can also just go to the store and get a little pin prick for your finger. Because if you wake up in the morning, and every single morning when you wake up, let's say you're fasting since midnight, and you wake up in the morning and your sugars are below like normal, they're like, let's say they're 120, 110, 100, then you're going to be fine for surgery, even though throughout the day you're spiking potentially because of what you're eating. So the hemoglobin A1C, ideally, you'd want to ideally trend lower, right? So if your hemoglobin A1C is 7.5, ideally you'd want to see it the same or lower going towards surgery. But the most important part is the fasting glucose in the morning when you wake up, and you want those to be normal. That's the key.
Thank you. And then I have Jess F. Des 86. She would like to know, for someone who can't take any blood transfusions, is a tummy tuck and BBL safe?
We've never had to transfuse anyone in our, obviously, as a result of surgery. We've had, I think, maybe 2 patients, or maybe 3, over the last 16 years who later on, like a week or 2 later, they were just pretty weak and a little lightheaded. And so we ended up having them go to basically an outpatient transfusion center and get some blood there, because they were out of town, they needed to travel, all that stuff. And these are patients that I did large volume liposuction, so we did 10, 12, 15 liters of liposuction. And those patients were doing fine. It's just that traveling back, it was going to be a pain in the butt because they get lightheaded the whole time. But otherwise, from acute surgery that we're doing here, we haven't had to transfuse anyone.
Thank you. And then I have Sleep with Sarah. She'd like to know, what process should a patient go through to judge their readiness for surgery?
Well, I think psychologically that's probably the most important part. So whether you're ready to have surgery, whether you've thought about it enough, or whether you're trying to accomplish other things in your life, things of that nature. So when you think you're ready, then obviously first things first is you got to have to do a consultation, because at least then you'll understand what's involved, what's possible, maybe what's not possible, what to expect. You'll get an idea of the financial components of it. And then beyond that, you really want to be in a good place, emotionally and psychologically and financially and things of that nature. If you have a lot of stress in your life with work and house and things of that, and the family and all that stuff, you may not want to throw surgery into that one as well.
All right, well, thank you, Dr. Repta. As we finish up,
Okay.
What state are we located in?
Oh, we're located in Arizona, the Copper State. We're in Scottsdale, Arizona. We're in Old Town, so we're about 10-15 minutes away from the airport. Our phone number is 855-377-3782. However, you can contact us via the website, via the virtual button there. You can message us here on Instagram or TikTok or YouTube or all the other channels out there. And we are about 2 weeks out on consults, roughly, and about 2 months out on surgeries, roughly. That's about it.
What are our consultation options?
Well, virtual or in person. So you can either do a virtual one if you're out of state or out of the country, or you can always fly here and do an in-person one as well. They're both that work the same, and I see you, even if you do a virtual one, I see you during a pre-op appointment a day or 2 before surgery. So, and of course I do the whole surgery, and you see me before, during, and after surgery. So No need to worry about all that stuff. Consultation fee is about $250. That gets applied to your account. So if you have surgery, then it gets applied to your invoice. So basically it's free at that point.
All right, well, thank you so much.
Thanks, guys. All right. Very good.